we know that there is a cure for sickle cell disease, so most people think there is not, but there actually is a cure. It's been around for about 30 years plus, and it's stem cell transplantation. And so, Dr. Heaney, give us your ideas of why you would consider transfusions for a sickle cell individual. Who should get it? So transplants. Who should get a transplant for sickle cell disease, and what does that process look like?
Well, so there are a number of types of stem cell transplantation that can potentially cure patients with sickle cell disease, and it really essentially depends on the source or the donor of the hematopoietic stem cell transplant cells. And then also there are characteristics of the recipient that are also important. In terms of the donor, probably the optimal donor would be an HLA matched or an immunologically identical person, and that's generally a sibling, a full sibling, same mother and same father. But there's only about a 1 in 6 chance with each full sibling that they'll be HLA identical. And so the big stumbling block with that is that most patients don't have a donor. Alternative donors would be a matched unrelated donor, or potentially even a haploidentical, meaning a half-identical family member. And these are becoming of interest now, but generally have overall a slightly worse outcome, although there's certainly some advances being made in those alternative donor transplants. And I think that really what's pretty clear from the literature now is that hematopoietic stem cell transplantation has a much better outcome if it's done early in life. I think certainly under age 10, and some would say under age 8 or even 5 would be the optimal time to do it. The challenge is that at that young age, you may not have the family's experience to want to undergo such a potentially procedure which could have some morbidity or even mortality. Currently, with a HLA identical sibling transplant, we describe disease-free survival or overall survival of over 90% in most academic medical centers. And so while there is quite a lot of hope for that procedure, there still is some morbidity and mortality associated both in the acute transplant period and in the follow-up period.
And so, Nirmish, what are the benefits? So why would a sickle cell individual seek out a transplant? Why would you consider referring an individual with sickle cell disease for stem cell transplantation?
Yeah, I think it goes back to what Matt was bringing up, is that we know that the benefits are better when the patient's younger. However, we have to balance the idea that there are definite risks of mortality. Patients may die with this procedure. And so then we're trying to find patients who basically start to have issues that then start to outweigh the risk that you're going to have this patient go through. And so that, those include patients who are having strokes, patients who are having recurrent acute chest, patients who have severe disease as classified by one of those type of complications. And then you, again, try to get those patients as early as possible. So then you make that referral, and again, that's when you start to try and make the decision, well, how much risk is that family willing to take? How much comfort do we have in having them referred to, outside of a matched sibling donor, to a clinical trial for a matched unrelated cord blood, et cetera. So I think we are making a lot of progress. It is a curative therapy, so the reason they go for this is that they have severe disease as defined by some complication, and we're worried that we're going to have progressive disease, and they're going to have a higher mortality, and we really just need to pursue some other option.
And so, Julie, for adults with sickle cell disease, does that mean that they don't have options? They don't have the potential to be cured? So what can we say to our adult patients in terms of your potential opportunity for curative therapy?
So, it's really exciting. We've done some new work in different chemotherapy models. So we know to give transplant, we have to make room in the bone marrow. We have to give chemotherapy in some capacity, which clears space for the new bone marrow. And starting with a group at NIH and followed by several others, they've done some trials with adults where we can use a little less chemo and still get great outcomes. And in fact, one of the NIH trial outcomes were almost as good as the kids, right? About 90% event-free survival and curative therapy. And we also know that the haploidentical program, which uses a little bit less chemotherapy and uses what we consider more immunologic mediated therapy, is also useful in adults. And so there's ongoing studies, and I certainly would suggest if individuals are thinking about this, that they stay on a clinical trial so we get as much data as possible so that we can make this better and better. But I think more and more these curative options are available to adults.
So there is hope. And so, Beret, so you are also an adult hematologist. Who would you not refer to transplant, and who would you refer over the age of 20? on the adult side?
Well, I agree with what Dr. Shaw said in terms of who you would refer. I think those individuals who have very few manifestations of chronic organ damage and are rarely affected by vaso-occlusive pain crises, I don't think that those patients would necessarily benefit from the risks associated with undergoing a bone marrow transplant. But I have the discussion with them, certainly. I think we all appreciate that everyone with sickle cell disease is facing a shortened survival, and I think that the risk-benefit ratio really does need to be discussed with the patient, because ultimately they're the ones that are going to decide which way they want to go. I will say, though, having sent several adults, including those in their 40s, late 40s, for curative bone marrow transplantation, I think one of the things that we need to appreciate is that after 20, 30, 40 plus years of living with sickle cell disease, there's a lot of chronic pain and a lot of chronic organ damage. And patients post-transplant who've suffered some of these problems expect them all to go away, particularly the chronic pain, a lot of it associated with avascular necrosis of the joints or destruction of the joints. And it simply does not fix the chronic pain in most circumstances. And another thing that's emerging is the psychological effects
Of having lived
of
with this
living with the
for so
disease
long.
and then not having it anymore. And believe it or not, that is psychologically problematic for a lot of adults with sickle cell disease, because so much of their identity as a person has been wrapped up in living with the disease and trying to live despite the disease.
So they don't know what to do with themselves.
They don't know
once
what to
they're
do with
cured.
themselves. A lot of them haven't gotten where they wanted to in life. And for the very first time are thinking long and hard about that and what's next. A lot of them still live at home, may not have employment, may not have the education or the tools to go out and get a job that can help them provide for themselves. So it's complicated.
Yeah.